Hi, it's Lynn, and welcome back to my channel. Today, I'm excited to welcome Dr. Breanne Kallonen, and we're going to do a deep dive into root causes of hair loss and analyzing some hair loss labs. Dr. Breanne goes into a lot of detail analyzing some of this lab work and shares what we should be asking for and looking for when we are getting blood work. Grab something to drink, get a pen, get a notepad, however you take notes, because you're going to need them. Be sure to leave a comment in the comment section so we can learn from one another. This will help ensure that women around the world will get access to this free content to help them on their hair journeys. Enjoy. So thank you so much, Dr. Breanne. I was excited to, number one, that you responded to my message in TikTok. But then also, I've been following you for a while now and really love your insights and what you're sharing out in terms of hair loss and metabolic health. And so we are excited to have you here. I will say this, what I appreciate about your message and your content is that it's very direct, it's very specific, and it's also very encouraging. Like everything about it is very positive. And for those of us who are dealing with hair loss, regardless of what phase we're at, it's helpful to see someone, an expert, and hear someone who gives a little bit of hope, right? And gives some direction. So thank you for that.
Thank you. I'm so excited to be here, and I'm looking forward to providing this education today.
Awesome. So can you tell us a little bit about your background and how you even got involved in dealing with hair loss and metabolic issues, all of that.
So my background was more on the very traditional, conventional science side of things, but I had never actually visited a doctor before. I was always very healthy growing up. I was healthy as a teen. I was healthy in my 20s. My first experience truly with conventional medicine was when I got pregnant with my first son.
Okay.
And with that experience, I really transitioned into functional medicine in terms of just making sure that individuals truly feel heard and understood. I remember at my postpartum appointment, I went in and I said, look, like, I really don't feel good. My energy is super low. I'm irritable. Words are flying out of my mouth before I could even think to catch them back. And I was losing my hair. I was struggling with my weight, all of these things I had never dealt with before. And I was told, this is what happens when you're a mom. This is normal, right? This is part of aging. And I was in my early 20s at that time. So I was like, this can't be right.
Right.
And it was hard, like having to do my own research and advocate for myself and really push to get functional medicine testing done. And it wasn't until that point that I recognized I actually do have something going on under here. These symptoms aren't normal. My labs aren't optimal. And that really led me into a trajectory of understanding labs from an optimal standpoint and really making sure that I'm helping people get access to this testing, because it's really challenging to manage what you don't measure, right? Like, how do you actually know what's going on? And especially when it comes to hair loss, it can be extremely stressful just to be told, don't stress, right? Stress,
Right.
don't stress about it. And to not really truly feel that anybody's done a thorough investigation. That's where I'm like, we have to do this. We have to figure out what those root causes are, because I think people are at the point where they don't want to just try minoxidil or spironolactone. They're asking the question, how do you know that that's right for me?
Absolutely. And so for those who may not be aware, can you give maybe just a brief sort of primer on what functional medicine is? I would say compared to, but how it's different maybe or expanded to traditional medicine.
Yeah. So from a functional medicine perspective, we are wanting to investigate always the root cause, right? So if you have elevated cortisol, or if your thyroid is not optimal, or if your vitamin D is low, if you have elevated androgens, those are all reasons why you could be experiencing hair loss. But then we ask the question of why. Why are those androgens high? Why is your iron low? Are you having heavy periods? Are you not eating enough red meat? Are you not absorbing, right? Like, it's not normal to be eating red meats and having really low iron. It's common, but it's not necessarily normal. And the other unique thing that we do in functional medicine is we look at the body as a whole, right? So if your iron's low, I need to look at your gut health, but I also need to look at your hormones, right? Are your hormones off? You're having heavy cycles? Do you have celiac? And is that why you're not absorbing your iron? And I would say the third difference is we want to ensure that these levels are optimal. The reference ranges on blood work are huge, right? And they encompass, everybody that goes into the lab. So we're not necessarily making reference ranges based off of an optimal population. We're making reference ranges based off of 80 to 90% of the North American population, which we know is as a total not all metabolically healthy. And especially when it comes to hormones, if you're a young female or a young male, you're not going to want the same hormones as, somebody who's in their late 40s, late 50s. So we have to interpret it based off of your symptoms, your age, your health factors, your genetic background. And especially when it comes to these ranges, are you truly within the optimal range? Not just, hey, do you need a medication?
Absolutely. Absolutely. I think that for me, one of my experiences was when I got a couple of years ago when I was newly diagnosed and I had gotten a vitamin D. The levels came back from vitamin D, and I don't support this, everyone. I had self-diagnosed that I needed some more vitamin D, but I had been taking it for 2 months. And then when I did the lab work, it was maybe in like the low 30s, low 40s. But that means if I had not been taking, the vitamin D for 2 months at 5,000, I think it was, who knows what it was before, So yeah, and also I will say that it was interesting because it almost said that it was normal, right? It was normal in the normal range. But then when I heard another physician, a functional physician online mention it, their goal was 80 or something like that. It was almost like what they considered optimal was very different than what the lab work said was normal.
Yes.
Right.
And I think the repeat testing is really important as well, right? Especially for a fat soluble vitamin like vitamin D, you can take too much of it. So we always want to say, okay, where are you baseline?
Right.
Initiate a treatment and then repeat those labs to say, is our treatment working? I think a lot of individuals, when it comes to hair, they need that objective proof to say, hang in there, like things are getting better. Especially when it comes to something like vitamin D. You have low vitamin D, that can cause hair loss for sure. But if we don't repeat the testing, maybe we're not taking enough, right? And maybe it's not that it's not working, it's just the dose wasn't right.
Right. Which is why I need to follow up with you anyway. So in terms of root causes, when we talk about hair loss, what would you say are some of the common root causes that you're seeing? And then from that perspective, we can actually go straight into your panels because you're going to sort of break down what these lab work panels look like. So we can give you the time to tell us about some root causes that you're seeing, and then let's just go straight into the panels.
Perfect. Okay. So one, nutrient deficiencies, whether that's iron deficiency, vitamin D deficiency, folate concerns, nutrient deficiencies is a big one. But again, we have to ask the question, why? Are you just not getting enough in your diet? Are you not absorbing? Kind of what's going on? Why are these low? I think supplements are wonderful. And I think that when you're deficient in things like iron and vitamin D, supplementing makes sense. But my goal is not to say, here's your 10 nutrient deficiencies, here's your 10 bottles of supplements. It's really like, why do you need that? Right. And how can we fix that from a lifestyle perspective? The second common pattern I see is telogen effluvium, right? Stress-induced hair loss. But again, what can we do to support that body so that it's more resilient to these stressors? We all have stressors and things that we can't control, but it's building that tolerance and resiliency that can be really helpful. Insulin resistance and blood sugar issues are a really big one. One, because having elevated blood sugar increases your inflammation. But also we know that insulin resistance and blood sugar concerns will change your hormones. It'll change things like estrogen, progesterone, testosterone. So that can be a contributing factor for hair loss in both males and females. Insulin resistance, we're going to talk a little bit more about, but that is what comes before you're diagnosed with prediabetes.
Okay.
And by the time you're diagnosed with prediabetes, you've already had insulin resistance for 10 plus years. So it's something where we need to do this comprehensive testing because it's estimated that 1 in 2 to 1 in 3 Americans have insulin resistance. So this is something that not just for hair, but also for your risk of cardiovascular disease, heart attack and stroke, dementia, Alzheimer's, certain types of cancers, it's really important to screen for. And a lot of practitioners are not screening for it.
Right.
Thyroid concerns, whether it's Hashimoto's, Graves, those are autoimmune thyroid concerns, or just regular frank hypothyroidism can cause hair loss. Changes to hormones can be a big one. And again, it comes to those optimal dosages and looking at where the individual is. If they're female, are you menstruating female? Are you perimenopause? Are you postmenopausal? Because high or low hormones can cause hair loss. And then the last one, it could be due to an autoimmune condition. So if we're thinking about alopecia areata, this is more of an autoimmune inflammatory type condition, although that's not usually as common.
Oh, really? Okay. Or
Yeah.
I've heard people that have had things like lupus, like they have other things that are hair loss kind of adds on as a symptom.
Exactly. Yeah. And then it comes down to, okay, why is the immune system mounting an attack on X, Y, and Z organ, right? And sometimes that's a little bit more challenging to figure out, but really looking at gut health, right? And a lot of the immune system resides in your gut. So what's going on there? And there's some fascinating studies showing that certain bacteria can actually trigger that autoimmune process. I don't think we fully understand everything about the gut microbiome, but it is quite a fascinating new area of research.
I think I feel like when you think about this is happening at the cellular level. So what are the things that impact the cellular level? Because it is nutrition and our mind, our thoughts, right? So I think there's got to be a connection in there somewhere.
And I think we could probably connect gut health to all of those things, right? So we know that certain gut bacteria are more associated with anxiety and depression. Certain gut bacteria are more associated with inflammation or better blood sugar control or metabolic control. Certain bacteria assist with thyroid function. A lot of your thyroid hormones actually activated or converted in the gut. So if you have concerns with your gut health, that can spread to all of these areas as well.
That makes perfect sense. So let's go to the lab.
Okay, let me share my screen. I'm excited to go through this. So these are sample case studies. I'm going to go through a couple of them today, different age groups, different rationales or reasons why the individuals are losing the hair. And I hope if you have some labs at home, you can pull yours up as well and go through it. This is part of a hair loss bundle that I've put together. This is something that you can request from your family physician, or you can order it on your own. And you'll be able to find that. I'm sure we'll include it somewhere just so you can see every marker that I would recommend running. When I'm in a patient consult, I go through every line item, even if they're normal, because I really want to ensure that I'm educating my patient so that they don't have to stress that, is it my thyroid, right? I think part of the stress with hair loss is not knowing, right? Was it really actually tested? Is it truly okay? Why do I still have those symptoms? So if we take the time to go through each lab marker and say, you know what, I'm actually confident it's not this, but it is this, I find that can be really comforting. So this particular case study, this was a 20-year-old female. She is experiencing hair loss, significant fatigue, and also weight gain. And when it comes to hair, I don't want to know just about the hair. I want to know about everything, right? Hormones, gut health. So we did a full intake. I did screen her for insulin resistance. That's something that I screen everybody for. This is concerns with blood sugar. I am so heavily focused on insulin resistance in my practice because it impacts so much and it increases your risk for the leading cause of death, heart disease. So from an insulin resistance perspective, the first marker I looked at was a hemoglobin A1C. This tells us, how have you been managing your blood sugar over the last 3 months? Technically, she's normal, sitting at a 5.4. She doesn't have prediabetes. All of that is wonderful. But then I take it one step further and I have a look at the levels of insulin. Insulin is the hormone that helps to keep your blood sugar down. when you get into insulin resistance, your body's going to make more insulin in an effort to control the blood sugar, because the last thing your body wants is elevated blood sugar, because diabetes hurts your eyes, your kidneys, your nerves. So your body's always going to protect yourself from having prediabetes by increasing insulin. But the problem with extra insulin is it can cause weight gain, fatigue. It can cause changes with mental health, acne. It can cause hair growth on the face in women, hair loss on the head. I like to see an optimal insulin really around a 4 to a 6. But this is, yeah, on the lower end. Yeah. But this again is where we need to have a look at symptoms. If an individual came to me and they're like, I feel amazing, my energy is great, my hormones are great, my periods are regular, I don't have hair loss, would I be concerned of an insulin at 13? No. But because this insulin, or because this individual is reporting, hey, I'm having sugar cravings, I'm having concerns with hair loss, I'm having weight gain, insulin may be something that we also want to have a look at. Okay. This is a big one when it comes to hair loss. It is incredibly common for me to see in my practice low levels of ferritin. Ferritin is a storage form of iron. If you don't have enough ferritin, you're going to feel fatigued. You're going to feel dizzy. You're going to have brain fog. There's some studies even in children with low iron, ADHD and ADD symptoms seem to be worse with iron deficiency, low motivation, of course, hair loss. 5.4 is low. This is even lower than, the reference range. And this reference range, look, it's 7 to 270. That's massive, right?
Right.
And it's so interesting, depending on, the area where you've done the lab, Canada, US, different lab companies, this range is flexible. It's really bizarre that, you can be deficient in Canada, but you're not deficient if you did your lab work in the US. It doesn't make much sense. For hair, I like to see a ferritin at least 80, ideally 100.
Okay.
Right? Because when we think of hair, it's something that we value, and it's a first impression that people see, and especially for someone who's struggled with hair loss before, it's quite traumatizing to see your hair fall out and think, how long is this going to take to grow back? So your body wants to protect your brain and protect your organs, doesn't quite care as much about the hair. Like, that's the nice to have. So we really need to make sure that this iron's coming up.
Right. And I will say I've had quite a few guests, and every single one says the same thing. The hair is the least important aspect that your body's trying to keep you alive, but it also, I think, lets you know maybe an indication of how much we kind of really need to figure out what's going on if it's gotten to that point, right?
Exactly. Yeah. And then my question is, what is your diet like? Right? Like, are you getting sources of iron? What are your periods like? Are they really heavy? Right? Do we need to investigate, like, why are you losing so much blood each month? Is there a fibroid there that needs to be corrected? Are you not absorbing things like celiac, gut concerns, dysbiosis? Those can all be reasons why you're not absorbing this iron. And, this is extremely low. I would say, for sure, you probably would benefit from an iron-based supplement while we look to why it's so low, right? And there's, some practitioners that will say, no, we have to kind of figure out why they're not absorbing it first, where I take, both ends we need to have a look at, right? I don't want this individual to stay this low. I don't want them to continue to keep losing their hair. So I think it's, a balanced approach of supplementing, but also looking to why it's low in the first place.
Right. Yeah. So for this person, we're still going through. Okay.
Yeah, we're still going through. Okay. Can we keep going? Yeah.
Let's go.
Okay. All right. The other thing that I'm seeing for this individual, and this is where I look at trends here, focusing on the red boxes. I'm seeing higher levels of inflammation, right? Something's going on, the body's inflamed, and lower amounts of vitamin D. There are individuals who are out in the sunshine all of the time. It doesn't matter if you're out in the sun. I would still recommend testing your vitamin D, because some people just cannot absorb vitamin D from the sun. Some individuals need 1,000 IU. Some individuals need 10,000 IU. Like, the dosaging for vitamin D is very individualized. So if this individual is supplementing with vitamin D, like your example, and their levels are still low, then they just need more, and that's okay. But vitamin D deficiency that's a big one for hair, for acne as well, for your immune system, your mental health. There's a published study that came out in 2023 looking at women in perimenopause and menopause, showing that vitamin D is even more important, not just for osteoporosis risk factor, but for metabolic health as well. So that's something that definitely needs to be corrected.
That's good to know, just because a lot of our audience is in that range of perimenopause, menopause, and where are we getting this information other than you, right?
That's, it's so cost effective, right? Like, even when we're looking at a supplement standpoint, vitamin D is not an expensive supplement.
Right.
It's even an expensive lab. Like, you're looking at anywhere from 10 to 20 bucks to run your vitamin D, and maybe you run it 2-3 times until we figure out the dose that you need to have. And for something so easy to correct, why aren't we doing it?
Right.
And if you look at a PubMed search, there's lots of really good randomized clinical control trials on vitamin D. So it's not a rat study, like it's a small little number. Like, there is human evidence out there that exists that shows the importance of vitamin D. So I think we really need to prioritize that a bit more.
I agree.
Okay. And then this one is a really big one. So this individual has significant hypothyroidism. So the TSH is really high, which means that the brain is screaming at the thyroid, please make thyroid hormone. That's what TSH means. The brain is yelling, like, listen up. If you have young kids and you told them the first time to put on their shoes, by the 16th time, you're getting louder. That's what TSH is. But when we look at the free T3, this is the most important active thyroid hormone. There is enough free T3, but the brain is really having to shout. So why is that? So something that we have to kind of figure out and have a look at. We know vitamin D is important for the thyroid. Iron's important for the thyroid. The thyroid does not work well under levels of inflammation, levels of stress. So when it comes to thyroid, I'm not always a big proponent of you have to take a medication. In some cases, you absolutely do, but I see lots of trends where the thyroid function actually gets better when some of these underlying issues are corrected. And I think when it comes to thyroid, everybody kind of like, I hope it's my thyroid. That seems very easy. I can just take a thyroid pill and everything will be fixed. But for anybody who's suffered with low thyroid function, they probably had the experience that the medication doesn't magically fix everything, right? There's usually other things going on at the same time.
So would it be, is it almost, maybe for this case, like the thyroid is almost a symptom of the other areas?
Sometimes
you'd have to,
okay. Yeah, it can be secondary, because if we look at this thyroid panel, the thyroid antibodies are not elevated. So this isn't Hashimoto's. This isn't the immune system attacking the thyroid gland. So it's like, okay, what's going on that, the brain's having to shout so loud? Why isn't the thyroid listening? And not in all cases, right? It's not in all cases that you fix the inflammation, you fix the iron, you fix the vitamin D, that the thyroid gets better. Absolutely not. But I have seen that happen before, where when we get the blood sugar under control, when we're making sure these individuals have the proper building blocks, right? Like, the thyroid needs building blocks. If you're not giving it the building blocks to build the hormones, then you're going to be running into some problems.
Right.
The other interesting thing about this thyroid panel is the reverse T3 is pretty high. So when your brain tells your thyroid to make hormone, your thyroid makes T4. The T4 then has to be converted to T3 or reverse T3. T3 is what you want. That turns the cell on, makes you feel good and energized. T3 is what you want. Reverse T3, it will clog the binding site. It'll occupy the binding site, but it won't turn the cell on. So for this individual, this is a problem, right? So you have enough T3, but it can't bind to the cell because the reverse T3 is blocking it. And then it's the question of why, right? Why is the reverse T3 high? Is it too low of calorie diets? Is it chronic fasting? Is it protein deficiencies? Is it inflammation? Is it toxin exposures? Is it medication? Is it stress? So that's where we have to kind of pick up these patterns and say, why are we seeing this?
This is fascinating.
all connected.
Yeah, yeah.
For this individual, and especially when it comes to hormones, I think, unless the androgens are really high, I want to fix all of the other things first, right? I am focused on blood sugar, inflammation, nutrients, then kind of thyroid, then the hormones are at the tip top.
Okay.
So, I don't think these hormones are necessarily optimal for this individual, but it's not my starting point unless the androgens are really high. There's much more things that take priority.
Okay.
Remember when we talked about the reverse T3 being high, one of the reasons could be stress and cortisol. Well, this individual has a cortisol way above what we would want to see it. So again, it's not just to say, okay, please don't stress about your hair loss. It's raising your cortisol. It's okay. What can we do, or what are stressors that we can control? Are you hydrated? What types of foods are you consuming? When are you going to bed? What are your friends' circles? Past childhood traumas. There's lots of things that we need to explore. You can use adaptogens, right? You hear about things like reishi, ganoderma, ashwagandha. Yeah, you can use those things, magnesium, B vitamins, but really looking at, okay, how are you perceiving your environment? And how can we make those lifestyle changes?
Right.
Because that could be definitely throwing off this case as well.
Right.
Lastly, other nutrients. People always ask me, what about this vitamin? What about this hair loss vitamin? For individuals who have zinc deficiency, vitamin D deficiency, yeah, some of those brands can be quite helpful if it's a therapeutic dose. For this individual, they don't have a clinical deficiency of zinc, clinical deficiency of magnesium. Are they optimal? Maybe not, but I think we have to do a stepwise approach, right? So let's do those first things first, then we can have a look. But if this individual just took a multivitamin for hair growth, they're probably not going to see any difference with it, right? They need that higher dose of iron, higher dose of vitamin D, figure out what's going on with the thyroid, the inflammation, the blood sugar.
Okay.
The other great thing that I'm starting to include, and this is just kind of like a sample case, you will receive descriptors of what each of these markers mean, the optimal ranges. I've set them here. The one thing that I really like to emphasize for individuals when it comes to optimal ranges is it does also depend on your symptoms, right? So going back to that example of, if you're maintaining your weight fine and you feel energized and you feel really good and you don't have any symptoms of insulin resistance, you don't have to have your insulin at a 4. The 13 is fine. But when we have to pair them with the symptoms.
Okay.
How was case 1?
That was fascinating.
Right?
Especially you could just do deep dives of this all day long of trying
all day long.
Right. Especially if you get to the point where you're starting to treat or support and you can see the changes. So this is really good. So everyone just you'll see this recording. Make sure you have your notes, your so you can take notes. And you mentioned that you'll give either definitely we'll have a link to your website that has information to the resources that you have regarding these labs. But then also you mentioned about sort of the markers to run for hair loss that we could make sure that we provide. Okay.
And the hair loss bundle, it's really comprehensive, right? So it's not just for hair loss, it's for energy, it's for weight management, it's for metabolic health, it's for your immune system, because you do, right? Like you have to look at everything together, because there's very rarely, one thing that's
right.
Okay, case 2. This is a 38-year-old female, similar symptoms, hair loss, of course, weight gain, mood change, fatigue. Let's see what was going on with her. This one, the hemoglobin and the insulin was a lot higher, right? So this individual, their body, their pancreas is working very hard. They're pumping out a ton of insulin to keep their blood sugar under control. So if you went to a conventional doctor and just ran your blood sugar, it would say, no, you're 5.6, you're great. You don't have prediabetes, everything's great, go home, be healthy, eat less, move more would be the general recommendation. But this individual has significant insulin resistance. Insulin is a fat storage hormone. It'll raise your cholesterol. It can raise your androgens. It can cause hair loss. It can cause acne. So for this individual, unfortunately, if something's not done at this point in time to treat it, it's probably going to get worse and worse and worse until, they go back to the doctor when they got the courage to do it again, because they probably felt dismissed. And now they have prediabetes. Okay, now we'll help you. I think that that's a missed opportunity, because there's lots of things that we can do here from, both a pharmaceutical and a natural standpoint. My role is to provide the education of all the available options and what the evidence has to say about each of them.
Okay.
And the individual who I'm speaking with, once they're equipped with all of that information, they're able to make that informed choice, right? It's not just here, take this, whether it's natural or pharmaceutical. It's like, this is what we see. What do you want to try first? Because the patient has to be part of the treatment plan.
Right.
Right. So yes, this is going to be a big contributing factor. The other thing that I can see with high levels of insulin like this is skin tags or darkening of the skin around the neck or the armpits, behind the legs. So other symptoms to keep an eye out for. Ferritin again. So this one here wasn't flagged low like our last case, but it's not much better. So again, this is something that we need to work on. This individual has higher amounts of cholesterol. So when your insulin's high, it takes the sugar out of your blood and says, okay, where are we going to put it? We can put it in body fat. We can put it as triglycerides in the liver. You start to see fatty liver. So it's not necessarily that we have to focus on the cholesterol piece. Cholesterol is important, but we need to say, how can we get the blood sugar under control? How can we fix the insulin resistance? And does the cholesterol come down as a byproduct of that?
That is so good, because it's not, again, it's the whole package, not just the actual number. Keep
like
going.
why, right? Like
Yeah.
you can have genetically high cholesterol for sure. But if you also have insulin resistance, why don't we treat the insulin resistance and see what happens?
Right.
Right.
Right. Especially because I feel like anyway, I need to follow up with you after this. But anyway, it's like it feels like, because I'm doing a lot of the research around it, especially when I think about, this is a sidebar, I'll do 30 seconds. When I was doing some research on some of the pharmaceutical drugs that they're now starting to put out are related to hair loss, I think some of the things that they're doing, it's tied to insulin resistance, like it's tied to metabolic health, put it that way. Like there's something going on.
Yeah. Yeah. And I want to just pop over to another screen quick here, and then we'll go back to the cases. But when we're looking at androgenic alopecia, especially for patients with PCOS, we think of PCOS as irregular cycles. You can see acne, facial hair, hair loss on the head, weight gain. And we always pick on testosterone. We say, okay, PCOS patients, androgenic alopecia, the problem is the testosterone. And then we have options. You have spironolactone as the pharmaceutical to lower the androgens. You have Solplemento. It's a natural herb that can lower the free testosterone, zinc, things like that. But what we see here is insulin resistance often is the root cause as to why the free testosterone is higher. So you can do both ends, right? You can still take something to lower your androgens because we want to stop the hair shedding.
Right.
But we still need to look over here and say, okay, let's temporarily lower the free testosterone while we work on the insulin resistance piece. And then let's reevaluate in 3 months when the insulin resistance is corrected. Do you still need that reduction? And this is where the testing comes into play. I see a lot of individuals being prescribed spironolactone. They don't know why. They don't know if it's working. It's like, did you do the blood work before to see if your androgens were actually high? Right? Because maybe your androgens weren't high. Just because you're losing hair at the sides and the crown, that's what we commonly see with androgenic alopecia. But that doesn't mean that you don't have a vitamin D deficiency. That doesn't mean that you don't have an iron deficiency. Like there's probably a couple more areas we need to have a look at.
Right, right.
All right. This individual also inflammation, which I see a lot of hair thinning at the back of the head due to inflammation. Another super low vitamin D. Like these are very common patterns that we're seeing. And it's not just individuals that aren't exposed to sunlight. This individual could use perhaps some thyroid support too, but again, not as significant as the other case that we saw.
Right, right.
So for this individual, what we really want to focus on is, again, that insulin piece, cortisol piece, blood sugar management, iron piece. So we are seeing a lot of similar trends between the cases.
Okay. Okay.
All right. And then these are, what they would have received when they got the blood work, the optimal ranges, the descriptions of what each one of those things mean.
Excellent.
All right, let's go through this one, because this is another common pattern that I'm seeing that individuals, I don't think, are thinking about. I think this is, so this is a 50-year-old female. Initially, she was concerned with fatigue. So she went to, I don't know if it was a med spa or functional medicine or what it was, but she decided that testosterone pellet therapy was going to be the answer for her fatigue, which I see a lot of individuals doing this. And the problem with it is we have to remember that hormones are all interconnected. So if you take a really high dose of testosterone, it could be fine, or it could be converted to DHT, which is the super testosterone that causes hair loss.
Okay. Okay. And this person also had hair loss?
Yes, but she had the hair loss that came after the pellet therapy.
Oh, okay. Okay.
So the pellet therapy has actually induced an androgenic alopecia presentation, where she loved the way that she felt on the pellet therapy. It gave her that really good wow factor, that boost of energy, that boost of confidence, clarity, energy. But the problem is, if you overdo it and you don't know how your body is uniquely going to respond to that, you've now implanted something under your skin that you can't get out. And this lab was done 5 to 6 months after pellet therapy, and her testosterone was still really high.
Okay.
Right. So I think testosterone replacement therapy has its place. I think it has some benefits to it. Absolutely. I'm just not a big fan of the pellet delivery system.
Okay.
I think it's extremely convenient, but this is some of the risks with it, that we can see that androgenic alopecia induction of the hair loss. Yes, her iron here absolutely is low. Her magnesium's absolutely low. I think she's more predisposed to having hair loss, but it was that really high dose of testosterone that triggered it.
Okay.
Right. So if anyone's listening and they're considering pellet therapy, it's not to say that it wouldn't be helpful for you, but you need to understand how your body is going to respond to testosterone. So maybe you start with a lower dose of an alternate means and monitor your labs to see what happens. Or you can run genetic testing. So your genetics will actually show you, hey, if we give you estrogen, how is it going to be metabolized? If we give you testosterone, how is it going to be metabolized? I wouldn't say that testosterone pellet therapy is going to be the best for everybody.
Right. So, and this is the first time I'm actually hearing about pellet therapy. So it's a hormone therapy for people that are in perimenopause to try to get their hormones.
Exactly. It's
stable.
A form of hormone replacement therapy, right? You can use creams, there's injections, there's oral options. This is a very convenient, essentially the hormones are implanted under the skin and they just, right? So it's easy peasy until you run into a problem like this.
Right. Okay.
So I've had a number of cases where it's like, I don't know why my hair fell out. I'm like, well, why is your testosterone so high? Oh, I did pellet therapy because my friend did it at a med spa. I'm like, oh, maybe that wasn't.
Not even physicians do it? They don't even do it?
The physicians do as well, but it seems like it's a very trendy thing that's happening right now. So be cautious on that. What do you think? Do we have time for one more?
Yes, let's do it. If you have one that's like a 40 to 50-year-old. Yeah. Any other, whatever the cause is.
So this individual, she wasn't quite 40, but 37.
That's close enough.
Close. Hair loss. She had joint pain as well. So again, we can see here high inflammation, insulin resistance. But this is what I really wanted to hone in for this individual. And I really wanted to highlight how important it is to get a full thyroid panel done. So the full thyroid panel includes TSH, so how the brain's talking with the thyroid. It includes the free T3, the free T4, and the reverse T3, but also the thyroid antibodies. Thyroid antibodies tell us, is the immune system mounting an attack on the thyroid gland?
Ah, okay.
You can have a completely normal thyroid panel, but have high antibodies. Some individuals, it's fine, right? There's a percentage of the population that can have high antibodies, no symptoms, they feel great, their thyroid's never affected. Okay, that's fine, no problem. But if you have one autoimmune condition, you're more predisposed to other autoimmune conditions. So even if you feel fine, you still need to monitor, and we still need to look out for other autoimmune conditions. There are patients who will have all of the symptoms of hypothyroidism when these antibodies are elevated. This isn't normal. I don't think it's normal for your immune system to start beating up on your thyroid or beating up in your intestines, right? Like your body needs to tolerate itself. And it's this lack of tolerance of self that leads to autoimmunity. So for this individual, we need to look at how are we going to address this immune dysfunction? Because if we don't address the immune dysfunction, they could develop autoimmunity in the future.
Okay.
And this is where we lead to some other testing. So gut testing. Do you have certain bacteria that are known to be associated with triggering autoimmune conditions? Insulin resistance can make thyroid antibodies worse. A zinc deficiency, a selenium deficiency can make it worse too. We do see the zinc is low here.
Okay.
So for this individual, it's a little bit different. It's more of the thyroid support, still the insulin resistance, still inflammation, but we're going to be tackling it in a little bit of a different way. What else did we see here? Vitamin D for this individual was actually pretty good. I think 50, most individuals in and around that point feel pretty good.
Okay.
And under that, you may want to supplement with, but I have patients where they're like, oh, I saw so-and-so on TikTok is taking all this vitamin D. And I look at their labs, I'm like, well, you don't need vitamin D. Where can we invest your finances elsewhere?
Right.
Like you think, or maybe a fish oil because your inflammation's higher. So it's very individualized approach, right? And yes, there's a cost aspect to investing in the blood work, but I think in the long term, if we can say, here are your key areas where you need to focus on, right? And, you don't need that hair supplement, or you don't need this, you just need the iron. That can be particularly helpful.
Right. And it goes back to what you said about you can't manage what you don't measure. And even though some of us going the traditional medicine route or just using our current sort of slate of resources, even that, from my perspective, isn't actually truly measuring in the, because a lot of when I say it's not measuring, or maybe I take it back, maybe it's measuring, but we're not getting the breakdown of what's going on or taking the time to understand why this is connected or how this is connected to this and the various options. So that's why I think this is so incredibly helpful to all of us. And even just from the mindset of understanding that we can go a little deeper to understand. We don't have to just take the surface level of response that's being presented to us in some cases. And there's resources like your organization that's out there that to help us, regardless of where we are, literally, it sounds like in the world, that you can support or you can work with patients who are interested in learning more.
Especially in the US where it's privatized healthcare, right? There's lots of really great lab companies where as long as you know what to order, you can go in, right? Like I want to empower individuals to say, this is what you need, right? This is kind of things that should be run standard each and every year. And even the American Association of Family Physicians, when we look at what they recommend for testing, it's actually a lot more than actually doctors are running. And even from a cash pay perspective, I send a lot of patients to a third-party lab company called Rupa Health. I'm not affiliated with Rupa Health, but they've got really great customer service and pricing. So for a full panel like this, you're looking at anywhere from $300-$400. Do you have to always keep repeating that bundle? No, right? You have your basic one, you get everything. And then if you're just working on vitamin D, then just repeat the vitamin D. And if you can find resources or educational free options that are out there, or if you can find a functional medicine practitioner, a naturopathic doctor, or even your primary care, sometimes it's just about getting the data, right? And going back to your primary care and being like, hey, what can we do here? So
right. And even for some, sorry about that. For some who are in the US, I know if you have privatized sort of insurance or insurance through your work, you can use your flexible spending dollars to order your own lab, like, so to get the markers and then use your flexible spending dollars to run the lab.
Rupa Health directly takes health spending accounts. So lots of
there's resources out there so we're not stuck, right? We're not stuck.
Yeah. Canada's a little bit more challenging when it comes to accessing labs, because it is you would need a prescribing physician to be able to access that. Although I help individuals in Ontario and I have a referral network. So if anyone's from Canada and they're requiring care, I can't see everybody in every province in Canada, although I have really great colleagues. So send a message to me. I'm happy to kind of say, here are some people that you could reach out to.
Awesome. And then also, before we, I guess we're almost done. Are you still good on time?
Yeah.
Okay. Any sort of, one of the things I like to end with is asking our experts, what is the next right thing that you recommend for people to do, right? So there's a range of women on this channel that are in various stages of dealing with hair loss, right? And so in general, because this is a really broad question, what would you say are the next 2 to 3 things that they could do to help themselves on this journey,
I would go back to basics. Are you sleeping? Are you pooping? Right? Like if we look at a baby, they're the happiest when they sleep and they poop and they're having fun.
Right.
You need to address those basics, right? Like, yes, this blood work is great. You need to have a look at this blood work, but eat healthy whole foods, get enough sleep, turn off your phone, go outside, right? Get away from the go, go, go. And one of the questions I ask all my patients is, what do you do for fun? And you know the number of individuals that can't answer that? Like, what are we doing? Right? So find your purpose, find your hobbies. I think that's really important and a missing piece in a lot of individuals' health plan.
I appreciate that. And I appreciate you for sharing that, because that's something that I think is approachable and doable, right?
Yeah,
I think
it's free.
It's free. And so thank you again so much. This is so valuable. I can definitely see myself going back to this and watching it again. But can you tell us where we can? I'll link it in the description box below, but can you tell everyone where they can find you, where they can follow you, anything that you'd like to share about how they can get in touch with you? Go for it.
Absolutely. So all of my social medias, Instagram and TikTok, are my name, Breanne Kallonen. And my website is also my name, breannekallonen.com. You can contact us through the website. You can send a message over on the social media platforms. And my front office staff, my patient coordinator, her name is Allison. She's absolutely fantastic. So if you need to get in contact with her, we're happy to help.
Yep. And I can attest everyone 100% to exactly everything she said, because this process was seamless in working with Dr. Breanne and her team. So I really appreciate you. Tell Allison, thank you. I maybe one of these days in the future, you can come back. We'd love to have you back, but thank you so much for your time, for your expertise, and thank you.
Thank you. Thank you for spreading the hope and the wisdom and the education. I know it's definitely needed and valued.
Awesome. Thanks so much. So if you made it this far in the video, thank you for sticking with us. I messed up on the last part of the video and I forgot to unshare the screen. And so you didn't get to see us talking, at the end. So I appreciate you for hanging out and sticking to the end, and want to give you a little encouragement to just take the next right step for you. It's a lot of information and can feel very overwhelming, but just take the next right step. You are not alone. God is with you, and He is your help. Live well, live blessed, nourish your crown, and I'll see you in the next video.